The goal of this video is to show how to practice and become proficient at microsurgery. You will need a microscope, forceps, microscissors, needle driver, suture of varying sizes, a small box like an empty suture box or cell phone case, and a glove. The first key to proficiency is becoming familiar with microequipment, including varying forceps. Familiarize yourself with different microscopes. This is our storage room with 10 different microscopes. Know your interocular distance and diopter preference. This will be the same for all microscopes. Understand varying hand controls and foot controls and decide on your preference. To set up your practice field, take a small box like an empty needle box and place a glove around it. There should not be too much tension on the glove, or when you make a cut in it, the edge will spread too far apart and have too much tension for microneedle suture to hold. This photo shows a balloon around a cell phone case. You can use any small box and elastic material. Early on, place towels under your hands if the box is elevated off the table. Initially, you should only be using the intrinsic muscles of your hand to maximize control of the microequipment. To facilitate visibility for this video, I will demonstrate with non-micro forceps and a needle driver. Initially, set up your cut in the glove at a 45-degree angle. Focus on stabilizing the edge of the cut glove with your forceps, passing the tip of the needle at 90 degrees to the edge, pulling the needle through the edge under control, following the curvature of the needle. Prepare for the next throw by pulling up on the suture so it's easy to grasp it, and in live surgery the suture will not be sitting in blood to facilitate ease of grasping the suture edge. Always use square knots to minimize the number of throws necessary during microsurgery. To review, focus on passing the needle perpendicular to the edge of the tissue. Follow the curve of the needle, place square knots, prepare suture for next throw, work on needle manipulation, and control the cut edge with forceps. Practice different ways to control the needle. This illustration shows using the suture to control placement of needle in optimal direction. Practice twirling the needle into different directions. Increase the degree of difficulty by turning the cut edge of the glove into different directions and change the inclination of the surface, as well as include backhand methods. This illustration shows backhand repair technique. When cutting suture, practice going to the spot to cut, stop, and cut under control. Do not cut while moving to the suture. To increase the complexity of this exercise and your proficiency, turn the laceration at different angles, place the surface at different inclinations, remove the hand support, and use increasingly finer needles.